Get Healthy Cincinnati from the Christ Hospital and these local partners.
I'm Warren Harding. I'm an orthopedic surgeon and I practice at the Christ Hospital. Some people are much better than others at figuring out how to describe a problem. Sometimes they use words that are used differently between the patient and the doctor, and sometimes they just don't pay attention. There are some people who are very good athletes who don't have to think about how to throw a ball. In pitching, for instance, generally there's the wind up, the cocking of the arm, the acceleration phase, the release point, and then the follow through. So if a pitcher can pinpoint that the pain comes in the cocking phase, when the arm is clear behind the body, and the pain is in the front of the shoulder, you can usually figure out that either whatever is in the front of the shoulder is getting stretched. Maybe what is getting injured is the back of the shoulder and it's being referred to the front, but generally it's the front of the shoulder that's being stretched in that position. Once you have that much information, by knowing the anatomy and the mechanics of throwing, you can figure out how to help the patient. And it's very interesting to me that one of my original epiphanies or bright spots in my sports medicine career was when I was the Cincinnati Reds doctor. I would sit in the broadcast booth sometimes watching from that perspective, and I would watch baseball pitchers, and I would listen to Marty Brenneman and Joe Nuxhall talk about what was going on. They both had very good insight into what was happening, and they would say, uh-oh, he's starting to throw up and he's opening up his body too soon. So I then would try to figure that out from my perspective as a specialist in sports injuries. And it pretty much became apparent to me that the people, when they were opening up their body too soon or turning their chest toward the batter before their arm was ready to go there, they were leaving their elbow behind the body, causing the shoulder to hyperextend into an unstable position and hurting their shoulders. And I do see a lot of athletes, elite athletes, and some not elite athletes who come in and have shoulder problems that prevent them from doing the things that they need to do. A typical example is a swimmer, somebody who's competing, somebody who might be just swimming for exercise, but swimming on a fairly regular basis, complaining of pain in the shoulder that keeps them from doing their workout. The first thing, going back to basics, is to make a diagnosis. Once the diagnosis has been made, then you can apply your knowledge of the sporting event, in this case swimming, and probably freestyle swimming would be the most common, and figure out where the pain is in the shoulder joint and at what phase of the swimming stroke. By using those two things, you can figure out pretty much what the problem is. The history is very important, also the physical exam. X-rays and MRI assessment and other exams will help, but the history is probably the most important thing, along with understanding the swimming sport. Once that has been, once the diagnosis has been made, then you can go about changing the stroke itself. So I would counsel with people and show them certain concepts. The basic flaw in swimming is usually that people are swimming and letting their elbow get behind their body, which hyperextends the shoulder into an unstable position, causing repetitive pinching of the burses and tendons, which leads to bursitis and tendonitis in the shoulder, which is what swimmer's shoulder is. Once you have that diagnosis, then you can modify the stroke so that there's more body roll, or you can tell people to breathe to the side of the shoulder so that the body roll is increased so people can swim more easily and more efficiently. You can use cortisone either by mouth or by injection, or even non-steroidal anti-inflammatory medicines such as Advil and Aleve. You can use heat, sometimes ice. You can caution people not to use paddles to improve the force transmitted through the shoulder, but you can tell them to use swim fins so that the kick will become more effective, driving the body through the water, still using the shoulders, but not to such an extreme degree. So that's the kind of plan that I use, whether it's a swimmer, it might be a volleyball server, it might be a tennis player, it might be a baseball player, or it might be a bricklayer. You can use all of these same principles, and by just paying attention and learning about people and what they do, you can usually help them without the need for resorting to more aggressive and surgical types of treatment.
Brought to you by the Christ Hospital, 5 WLWT, and the Inquirer.